Let's look back at how screening and diagnosis were done for Daryl. Daryl got screened for head and neck diseases when he went to his regular dental clinic and saw the dental hygienist. She completed an examination of his head, neck, and oral cavity. He had a chipped tooth, but she also found a suspicious lesion on the left side of his tongue. The dental hygienist discussed it with the dentist, and together they discussed the concern further with Daryl. The dentist referred him to an oral medicine specialist in Edmonton, who biopsied the lesion. The biopsy tissue was processed by medical laboratory technologists for review by a pathologist. The pathologist's report indicated a common type of tongue cancer called squamous cell carcinoma. Daryl begins his treatment. He was referred for surgery and admitted to a hospital in Edmonton under the care of a surgical team. His head and neck surgeon worked with several nurses, a pharmacist, a dietitian, a physiotherapist, an occupational therapist, a kinesiologist, and a speech-language pathologist to care for Daryl. Daryl had some pre-surgery tests, then his surgery, and stayed for post-operative care. The resected tongue lesion and some lymph nodes removed from his neck were processed by the laboratory team. It was now confirmed that the cancer had spread to some of the lymph nodes in his neck. Daryl now needed a combination of daily radiation therapy with weekly chemotherapy for 6 weeks, and the surgical team referred him to the cancer center. The radiation therapy was given under the care of a radiation oncologist, radiation therapist, and oncology nurses. They coordinated with the medical oncologist, pharmacist, and oncology nurses who treated Daryl with chemotherapy. Both teams collaborated with the rehabilitation team's dietitians, speech-language pathologists, physiotherapists, occupational therapists, and kinesiologists to ensure Daryl's rehabilitation starts early. Further support for Daryl and Shelley was provided by social workers and psychologists. The radiation team also referred Daryl to an audiologist, as the radiation puts him at risk of hearing loss.